Good afternoon, and thank you all for joining us. I want to begin by acknowledging the terrible milestone our country reached this week, the over 500,000 now fellow Americans who have lost their lives to this virus, including 511 of our neighbors here in Denver. This pandemic has taken a terrible toll on the lives and livelihoods of so many over the last year, and we will never forget what our community, state, and country have lost, because it should be on our minds as we prepare to move from rescue to recovery. Every day, we get a little more news that should give us all hope that the end is in sight. The Biden administration is making more vaccines available every week. We should have news soon on the emergency authorization of the Johnson & Johnson vaccine, which is a one-dose vaccine and will greatly increase the number of vaccines available to go into the arms of those who need it right now. I'm also going to keep advocating for more direct allocation of these vaccines to Denver and other cities. Whatever we can do to get needles in the arms of Denver residents sooner and improve equity here, we're going to continue to advocate for that. And for some cautiously optimistic good news here in Denver, our numbers are in a much more manageable place today. And if we keep on this course and people keep doing what we're doing to keep themselves and others healthy and safe, we could be in for additional capacity at local businesses very soon. But let me caution, if we let our guard down because we think we're over the hump or because of fatigue, we could easily see those numbers shoot right back up. So if we want to see these numbers continue to go down, wear your mask, don't gather in large groups just yet, and maintain social distancing. We're also at the goal line, so let's do everything we can to protect the ball right now and make positive yardage. That's an important analogy with our football team. On the vaccine front, with more and more doses being distributed every day, we're planned and prepared to support wider and more equitable distribution when it's available in a three-tiered system, and I want to share that with you right now. Our first tier is to support the community health system, such as our hospitals and community clinics, with their logistical needs for sites located here in Denver. The second tier will be to establish fixed neighborhood vaccination sites, like the one you saw last week in Mount Bello, to support those residents in unserved neighborhoods and provide equity in vaccine distribution. For an update on this, we are formalizing the partnership now with the State Public Health Department, 9Health, and Safeway to establish our 4 additional fixed community sites. And we should have that completed within the next couple days so those sites can get up and running. And our third tier will be deploying mobile vaccination teams to reach those residents who don't have access to receiving the vaccine but are eligible to receive it. I want you to know this isn't a prioritization list. We want to make sure that we're working on each tier simultaneously and as effective and efficiently as possible to reach as many people as possible. Of course, with me today is Bob McDonald, our Public Health Director, who will provide more on this plan here shortly. Equity is driving and shaping our planning around vaccines, as well as the public information we're providing to the community about their safety and the importance of the vaccination. If you haven't yet, I would encourage you to take a look at the community conversations we've held over the last several weeks to help get this information out to the folks who need it. These conversations have been far-reaching and impactful. We've done one for the African American community, the Asian and Pacific Islander community, older adults. We've done one for the Latinx community. And I think we have a couple more planned. This is about reaching those communities that we know are struggling, first of all, have been disproportionately impacted by the pandemic, but are also struggling to get access to the vaccine. We fully understand and appreciate that the state has to keep their focus on statewide needs of Colorado residents to support that effort. We're going to keep our focus on making sure this vaccine gets to as many people in our city as possible by removing the barriers to them getting it. We're almost there, Denver. Mask up, social distance, and let's keep our eye on the ball as we approach the end zone. With that, I'm pleased to turn it over to our Executive Director for Public Health, Bob McDonald. Bob?
Thank you, Mayor. Let's go to the next slide here. Before I start talking about our vaccination plan, I just want to take a quick look at where we are with the curve of this pandemic. You can see the spike that we saw back in the later part of November and how much it's dropped in the last couple of days, or last couple of months. But take a look at the tail end of that curve. You'll see that numbers are starting to tick up. Now, I've said before in previous updates that the last few days you have to take with a grain of salt because that will be reconciled during the reporting process and data cleanup. But as I look at the day-to-day numbers, they are ticking up slightly. Now, I want to say this, and I can't stress this enough. We, in the decisions that we make, we are going to be driven by data. I'm often asked this question, are we opening up too soon? Are we opening up things too quickly? We have variances that will soon be proposed, pilot projects. We have variants of the initial virus. We're going to be driven by data. If it was just a matter of keeping case numbers down, that would be easy. Let's keep everything closed, right? Lock everything up, everyone stay at home. But we are battling two pandemics here, the virus and the impacts that we can see from harsh public health measures, right? We know that the more we keep things locked up, the more we put stress on the economy, the more people lose their jobs, they struggle to pay rent, they struggle to buy food, they struggle to pay their mortgage. And then we have more public health problems. So it's a delicate balance, making sure that we keep numbers down, but protect the economy, protect jobs. Next slide, please. So just a couple of reminders. The state tiered system and the allocation is managed by the state. And we can't deviate from that. The mayor's been a strong advocate to get vaccine delivered directly to the city of Denver because we believe we know what's best in terms of how we can allocate that across the city of Denver with the lens of equity. We'll keep advocating for that. The limiting factor right now is access to vaccine. The Emergency Operations Center has been working hard over the last many weeks, working very closely with the Racial Equity Council. A Deputy Chief of Staff under the Mayor, Aaron Brown, has been deployed to the Emergency Operations Center to make sure that every decision that is made at the Emergency Operations Center is done with the lens of equity. Next slide, please. Quick update on where we are with the number of people that have been vaccinated with 1 dose, 2 dose, and both doses. The one that stands out to me the most, I believe, is the orange line there. The number of people that have been at least vaccinated with 1 dose. And I say that because regardless of the vaccine, there's data that shows even the first dose provides a good measure of protection. We still need to be diligent with the Pfizer and Moderna vaccines. We need to make sure that you get that next dose scheduled. But the quicker we can get at least 1 dose into everyone, the better off we're going to be. Next slide, please. As I said, equity is the foundation for everything that we've done. We did this with our testing plan. We mapped out where testing was occurring, and we did that intentionally so that we could wrap a testing model around that, focusing on areas where there wasn't enough testing happening. And in the next slide, you'll see depicted in a different way how we do see some racial disparities with who is being vaccinated. This data is pointed out to me almost every day. But we worked very closely with our partners at Denver Public Health to develop this data, and we did that intentionally so that we could build an equity model around the disparate data that you see here. We're very much aware of this, and it's the very reason that the Racial Equity Council, and again, every decision in the EOC is made with this data in mind. Next slide, please. We are taking this and been working very hard over the last couple of months to build this vast network of locations that everyone can get to with pharmacies, clinics, and we'll talk about the sites that the city is standing up, static testing sites. I have nothing against, I'm often asked this question about these mobile sites that stand up for a day or two, the drive-through sites. They do a lot of great work, but we need to do even better than that. We need to stand up static testing sites where people can go when convenient for them, and they can rely on those sites being there during the duration of our vaccination phase. Next slide, please. These are the three strategies that we're relying on, supporting, again, those pharmacies and those clinics so that we have a wide range of locations that people can go to. With that, though, we recognize that some neighborhoods don't have pharmacies close by. We recognize that people can't get to these sites as easy as others. So we are establishing fixed neighborhood vaccination sites embedded into underserved communities, targeting people of color and those that have been disproportionately impacted by the pandemic. And then we're going to deploy mobile vaccination teams to locations to even add further to our efforts of getting to those that can't reach us, setting up events. Those won't be static events, but we will be prioritizing underserved communities with those mobile teams. And I will say today that we are now looking at a mobile unit that can go still, just like our testing center, go to those that can't get out of their house, those that might be a little bit more immobile. There are some challenges with that, but I'm confident that we're going to be able to pull that off just like we did with our mobile testing unit. Next slide, please. The fixed locations you can see here, the Montbello and Swansea site are already stood up, and the next 4 you can see the projected date for those. The goal with every one of these sites is to make them operational as many days as possible with flexible schedules to make it convenient for, again, our most underserved populations to get to them. And we will continue to communicate as these sites are stood up. We'll push that information out. The other thing I want to focus on is, again, it's not just where these locations are, it's communicating where they are, and then also making that registration process as easy as possible. We know that everybody doesn't have the same tools or the same skill sets in terms of navigating through the registration process. We know it can be complicated. The EOC is working hard to break down those barriers. Next slide, please. We've made some progress here, but we need to do a lot more. As the mayor mentioned, we anticipate getting tens of thousands of more doses, much more than we are now. And the infrastructure, by the time we get those doses, the infrastructure that we've talked about this afternoon will be in place so that we can get the vaccine to everyone and get it to them efficiently and timely. Next slide, please. Until then, we need to stay the course. As I mentioned this before, this will be the last thing that goes when we pull ourselves out of the pandemic. You do not need to wear 2 masks, okay? But you do need to wear the right mask, and we all need to wear it properly. We need to, ideally, you should be wearing a mask with 2 layers, like a surgical mask that I have in my hand here today. I see this, we've all seen this. It pulled down below our nose. Sometimes I see it hanging on someone's ear. That's not going to provide the type of protection measures that we need. So remember to wear the right mask, to wear it properly. It should fit snugly around the nose and the mouth and fit closely around the face. Next slide, please. With that, I'll turn it back over to the mayor for questions.
Thanks, Bob. We'll go ahead and go to the system for Q&A. Teresa?
Great. So we're going to call on those of you who pre-registered with us first. So thank you very much. We're going to start with Meg at the Denver Post. Meg, do you have a question? We'll try again in a minute. CB from Denver 7. And you can *6 to unmute.
Thank you.
Go ahead.
Hi, Mayor Hancock. I'm wondering if you have an update to the second letter you sent the White House requesting more autonomy over the vaccines.
Not today. I did get notice that yesterday that the White House has reached out and wants to communicate with me, and so we'll make that happen in short order, and then hopefully after that we'll make sure you get an update. We understand this is a very difficult request, and the White House and the state are trying to do everything they can. Supply is a big issue, as Bob has pointed out, and as you have seen with a lot of the news coming out of the White House. We're optimistic further down the road that we'll have more vaccines and be able to hit more people with the vaccine. But right now, we are really just trying to establish the value of getting to a lot of the underserved community and members of those communities as quickly as possible.
Let's go ahead and try Meg again from the Post. Meg, are you there? Allie from 9 News. Remember to star 6 to unmute yourself, please.
Okay, I guess yes.
Okay.
So I'm just curious, is the city looking at allowing fans soon for indoor games? And also, what does that look like for opening day at Coors Field and, of course, Ball Arena as well?
I'm sorry, I want to make sure I answer the question as well as I can. Could you repeat the question, please? I heard Coors Field and...
Allie, can you try that again? and
Yeah,
just-
sure. Sure. I'm curious, is the city looking to allow fans soon for indoor games at Ball Arena? And also, what does that look like for Coors Field? Opening day is coming up.
Yeah, great question. All professional sports, the decisions regarding what can open up and how many fans can be in the stands is being made by the state health department. But we are working very closely with them. We know that opening day is coming up. We're going to keep talking with them in collaboration on that decision-making process, but ultimately it'll be up to the state health department to decide that. We'll work closely on implementing that and making sure that there's compliance with whatever suppression plan they put in place.
Esteban from Denver Right. I don't know if you dropped off, but go ahead and star 6, Esteban, if you're there.
Hi, this is Esteban. Along the same lines, I was hoping if we could get an update on any potential variances for some of the other city arenas, city areas like Red Rocks, library systems, that kind of thing. Mayor, I was curious if you think it's important for these kinds of places to be able to open here soon.
Yeah, I'll have Bob come and update you on the variances that have been filed, but absolutely, Esteban, these activities in the life of our city are extremely important. I was just thinking as Bob was answering the question regarding our sports teams. I mean, I have not seen the Nuggets live or on television in literally over a year. One, because of the conflict with their contracts, but also because we can't see them in person. That's an issue because they unite our community. They bring us together. They give us a common objective to root for. And it's really unfortunate. And obviously, music and the arts play such a critical role in the life of our community, not only economically, but culturally. And the fact that we've not been able to partake is also a major gap in our quality of life in the city. And let me just do a special shout out while I'm thinking about it, to our artists, our performing artists and visual artists in our community. You know, most performing artists, and I'm going to say close to 100% of them, not performed in over a year. My wife being a performing artist, we have watched as many of our friends and close colleagues of hers have, been devastated by this pandemic. And so obviously we want to see our performing artists get back to work as quickly as possible for their own, not only livelihoods, but their own mental health. But Bob, you want to talk about the variances that have been filed?
One of the things that we haven't clarified is what phase are we in? We're in the yellow phase right now of the state style system. We thought that the state might move us to the blue phase based on numbers dipping below 100, but they've ticked back up above 100, so back in the blue phase now. So indoor variances can't be approved at this point. We have received some which are being reviewed by the state health department. We've received one from Visit Denver for the convention center and other very, very large venues. We've also received a plan from Red Rocks and other venues. And I want to say this, that I will always support a thoughtful plan, provided case numbers stay down. If variances are approved and when you start to see numbers tick up again, we're going to respond quickly with rescinding those variances, even if done at the local level. But I think it's responsible it's the responsible thing to do, to take a look at those thoughtful plans to see if there's more that we can do, striking the right balance between public health and everything that those venues bring to our community.
All right, let's go to Vinny from Bloomberg.
Hello, can you hear me?
We've got you. Go ahead.
Thank you very much. Hello, Mayor Hancock, Mr. McDonald, Teresa. This is Vinnie Dell, Judas Bloomberg. How does Denver plan to deploy the Johnson & Johnson vaccine once it arrives? And will the J&J vaccine be used in the city to target any specific populations? Thank you very much.
Well, quick answer to the second question is no. You know, we're not going to look at these vaccines and target specific communities. The bottom line here is whatever vaccine is allocated to the city of Denver, we're going to use it responsibly, timely, in a thoughtful way, pushing it out as fast as we can. That's the very reason we want the vaccine to go from the federal government directly to the city of Denver. So in answer, you know, I think the bottom line here is that whatever vaccine we get, we're going to push it out as fast as we can, otherwise it does no good. So, but we're not going to target individuals or certain communities with a particular vaccine.
Let me just say that to follow Bob's statement, that we started this rescue phase with the vaccine as this North Star, vaccinations, widespread vaccinations, with the commitment that our goal is to get needles into the arms as quickly and as diverse as we possibly can throughout this city. And so Bob's point is right on with regards to that objective.
All right, we have John at Axios, and I had to mute a couple folks, so go ahead and star 6 when I call you out. John?
Mayor, hi. John Frank from Axios Denver. This is a question for you. Three parts here. How close are we to the blue level? What will it take to get there? And how important would that be for the city to move to that level?
Yeah, I appreciate it. I'll have Bob come and join us for this answer. We were very close. In fact, we expected as a team that we would be there, I believe, late last week, but for, again, penetrating that 100-plus line. So we're very close as a community. I think it says something about the people of the city, how close we are. And it means an awful lot, obviously, increasing the capacity of the public venues and again, continuing to improve the balance of safety and the economic vibrancy of the city. So it's incredibly important we get there, and we are going to get there ultimately, and I think very soon. But as Bob had pointed out, the fact that we pierced that line again, we have to start over on the 7-day dial. So I'll let him talk about that.
Yeah, so the mayor's right about that. The state's policy is that you have to be in that metric for that phase for at least 7 days. So when you look at the chart that's on the screen now, you have to be under that 100-case threshold for at least 7 days. We were at 6 days and anticipated, you know, maybe being moved into the dial in the next 24 hours or so, and then it ticked back up above 100. So we will have to be, it'll have to drop below 100, and we'll have to keep it there for at least 7 days to be considered for the blue phase by the state health department.
Thanks, John. All right, that's all I have for folks who had got on the line ahead of time. Anyone else that joined us late? Who is it?
Hi, this is Meg. Can I ask my question now?
Absolutely, Meg. No, I called on you first. Go ahead.
I know, but you couldn't hear me. So
go ahead, Meg. We got you now.
All right. Okay. All right. So at the beginning, you had mentioned about seeing a bit of an uptick in cases the last couple of days, but we're still talking about hopefully going into the blue pretty soon. So are you thinking that's just a blip, or do we kind of have to wait and see if that's anything meaningful?
She wanted to know if it was just a blip, Bob, in terms of us piercing that veil again, going back over 100 plus. And let me just reiterate again, Meg, we celebrate city residents and visitors who've done an awful lot to get us into the category, the tier in which we're in today. And of course, the goal is to keep going, and I believe we'll be in the blue soon, as Bob has pointed out, and we'll keep going. The reality is that the bottom line is we control our destiny here, and I think the people recognize that, businesses recognize it, and they're doing everything they can to get us there and to keep us there.
Yeah, the only thing I would add to that is that, regardless of what strain of the virus is in our community, and we're seeing very few cases of that right now, but regardless of what the strain is that we're seeing or various strains, this is the most protective thing we can do as individuals. And I can't thank everyone enough. Just the level of compliance that I see at the individual level by a wide range of businesses is really encouraging. That's what gets us under the blue again, and that's what keeps us there.
Meg, thank you. Any other journalists on the phone? We can take a couple more questions.
Hi.
Go ahead.
So I noticed that on the list of some of the community vaccination sites, those are rec centers. Any update on when all of the city's rec centers and pools might reopen this spring?
Yeah, so we're working very closely with our partners in Parks and Recreation along those lines. It's important to get those rec centers open. We recognize that there's, people are stressed these days. They need to get out and exercise and do the things that we all enjoy. We anticipate that in the upcoming weeks, provided that we stay at the level that we're at or that we continue to drop. We expect that they'll be open in the upcoming weeks.
All right, thank you. One more question. Anybody else?
All right, let me thank you all again for this opportunity. Let's remind ourselves to continue to follow the guidelines that we have been given, to wear these very important masks, to try to avoid large group gatherings and social distance. God bless you and thank you.